So my husband and I decided to do a quick podcast
Yes.
here on What the Actual Health because there has been a lot of noise on social media
A lot.
regarding some US FDA pushes.
Changes?
Yes.
Yes. Oo.
So it started, we're actually really happy when it started with the banning of food coloring in food products.
Right. Red number 3 in particular.
Something like that.
Yeah,
Sorry.
oo.
I forget which one. Was it red, yellow, or blue?
Red 3.
And they are given, the US producers are being given
Certain.
2 years.
Yep.
Correct?
Correct.
To totally eliminate this food coloring
Yep.
from food.
Yep.
When in fact, in cosmetics, it has been banned
Since the 80s.
since the 80s. Funny, no? I mean, just a side note, that's quite funny that it has been banned in cosmetics because it's harmful daw when you put it on your skin
Yeah.
pag pinahid mo, but it was still
Being
permissible in food, something
When
that you
you-
ingest.
Yeah, take in, no?
Yes. But,
Doesn't make sense, right?
Yeah, it doesn't make sense.
Labo.
But now, there has been talks about the use of painkillers while you are pregnant
Yeah.
may lead to autism in your offspring, in your children.
Right.
So that's what we're here to discuss.
Correct.
Okay, Harvey, go ahead.
So, I think Donald Trump, the U.S. president, just came out, I think just yesterday, telling us that Tylenol is not something that you should use while you are pregnant. So normally Tylenol would be given if you had...
Tylenol is ibuprofen?
No,
Tama ba?
it's the other one. Not
Acetaminophen?
Yeah, that's the
Okay.
one. Okay. But ibuprofen also should not be used during pregnancy.
That's what they said.
Yes.
Okay.
Oo. So, yun.
And what is the link that they're trying to establish?
Well, you take Tylenol because you generally have a fever, your immune system
Pain,
drops.
or you have some sort of pain.
Severe pain,
Uh-huh.
that it drops to a point that your immune system can't handle it and you develop a fever. They say there's talk that when you have a fever during your pregnancy, it may cause a little bit of harm to your baby.
Okay.
So that's
Actually,
why.
I would love for you to insert the clip that you showed me.
Because it's really important. It's actually a clip by CNN, no? CNN.
No, it's a report from
yeah, it's a report
CNN,
from
yeah.
CNN. Oo.
Okay.
The
Sige.
Trump administration says that Tylenol may be linked to autism.
Yeah.
Tylenol during pregnancy can be associated with a very increased risk of autism.
But experts say taking Tylenol during pregnancy is okay.
There is no causal relationship between taking Tylenol, Paracetamol, Acetaminophen in pregnancy and later on having an increased risk of your baby developing autism.
This can all be confusing. So if you're pregnant, don't panic. Here's what you should know. The Department of Health and Human Services is advising doctors to prescribe the lowest effective dose and for the shortest amount of time when it's needed during pregnancy. And this is generally in line with what most medical organizations say to do. Major medical groups in the US, including the American College of Obstetricians and Gynecologists, say that the benefits of Tylenol to treat fever and pain during pregnancy outweigh potential risks. Of course, they also say that you should discuss any medications that you take during pregnancy with your doctor. Earlier this year, a review of studies on the most commonly used pain medications during pregnancy found that some drugs can be risky. Using the steroid prednisone during pregnancy may cause a cleft lip or birth defect. And research suggests taking ibuprofen during the first trimester can cause miscarriage, and it has been linked to multiple birth defects. Some links to birth defects were also found in the third trimester. And another thing to know, it is important to reduce severe fevers during pregnancy. Separate research has found that a fever during the first trimester could be especially dangerous, raising the risk of congenital heart defects, neural tube defects, and oral clefts by up to 3 times. And high-grade fevers during pregnancy can affect the fetus's brain development. So your doctor may recommend Tylenol in these cases. The Trump
So
administration.
that's what the CNN clip said.
Yes.
Because yung nga, Trump came out and he said that it can increase or may increase the risk of autism in children. So
No, he actually, from what I know, is that it does increase. Not
he
may
said
not.
may increase.
Uh,
Just there in the interview, he
well,
said it verbatim,
sige.
may increase. But you mentioned, Harvey, that the reason why you want to discuss this is, doesn't it get confusing now? Because US
Yeah.
FDA na to eh.
Yeah, kasi si Robert F. Kennedy Jr. is the head of Department of Health sa US.
Now, he is the
oo.
head of
So,
Department of Health.
He's
okay.
basically also asking the FDA to basically give these warning labels into these drugs, no?
So yun nga eh, it gets confusing. So if
Ano
the
na?
US FDA
Diba?
is now required to give these warnings, and yet our doctors are saying another thing, as a consumer, as a patient, medyo confusing na siya.
In fact, doctors are confused already.
Oh, that's
So,
true. Kasi
they're confused. They don't know, diba?
They have to abide by, if you're a practicing doctor in the
Yeah.
US, you have to abide by US FDA
Yeah.
or the US Department of
Oo.
Health. And in the Philippines, we mirror what the US FDA does.
Pretty much.
So, where do we stand now? But one of the things that was mentioned in the report a while ago was that the directive now for the doctors is to give the lowest dose possible and only when needed and short-term cycles lang.
Yeah.
So I guess that's where the problem lies.
Yeah.
I mean, tayo pa naman kasi, if there's something masakit, take medicine.
Yep.
Konting sakit, take a pill.
Oo.
Konting discomfort,
Yeah.
take a pill. Naulanan, take a pill.
Sobrang
Ganun
subjective
siya.
'di ba? Meaning hindi siya yung talagang a hard-nosed rule na ito yung level of pain. Saka the level of pain for everybody is different.
Different, yes.
'Di ba? Tapos some people take it as a prophylaxis.
Oh my gosh,
Di
yeah.
ba?
You know, funny thing to note, I know someone
Yes.
who thinks that these pain medications that are meant to lower high fever
Yeah.
can be used as preventive. Yung tipong pag naulanan sila, biglang dadaan ng pharmacy
Yeah.
to buy and take it.
Yeah.
Na, sabi ko, why are you taking that?
Correct.
Para maagapan yung lagnat.
Hin-
It doesn't work that way.
Hindi lang 'yon, pati yung mga let's say nagba-basketball.
Talaga?
And then after basketball, para hindi sumakit yung katawan nila right after the
So,
game.
kumbaga, hindi pa nga,
Yes.
there isn't a chance for it to get inflamed,
Yes.
which is the body's natural process.
Yes, to heal.
To heal itself. Nagtitake na sila. Kasi nga, is it misinformation,
Yeah.
lack of information? I don't know where it is coming from.
Yep. In fact, let me just say, in that report, it talks about prednisone, it talks about ibuprofen
As well.
as well, right? In fact, we deal with a lot of people here, pregnant women at Barron Method, and we hear those drugs being taken on a regular basis.
Okay.
So one of the things that was eye-opening for me when hearing that report from CNN was that the immediate reaction of most MDs or for people who have these issues would be na parang, take a pill. Does that make sense to you? Parang ganun na lang ba talaga tayo? Have we gone into the world na nasa mundo na talaga tayo ng, ito problema, take a pill. Ito problema, take a pill. But
Well,
then,
in all fairness, you also deal with patients and clients at Barron Method na yung doctors nila, take a pill, pero they tell the patient, but you have to change because your pill is a stopgap measure. But unfortunately, that would be the minority of doctors.
Yep, that's the problem. So where we stand, where Barron Method stands, is that food itself, the healing. When you talk about food that heals, it is also something that can help prevent disease. If you were to look at, say, a fever during pregnancy, you didn't get fever during pregnancy, di ba? Wala kang
I never
ganon?
really got sick, but I
Oo.
remember distinctly there was one time I had to take a painkiller because I had a really bad headache.
Mm.
I forget if that was my pregnancy with our son or our daughter, but it was once.
Yeah. So it's why I think if we can take care of your immune system throughout the entire time, then most likely a fever or your immune system would not drop. I think there are ways to be able to manage it, and when you eat healthy, when you eat well, it shouldn't happen that way. But the problem kasi is when women get pregnant, it seems to create a license for them to eat anything. Parang
Yeah.
they tend to eat whatever they like.
Oh my gosh.
So
I was just talking
cravings,
to-
sweets, all of these things kick in, right?
To an acquaintance of mine who has become a friend. We chat frequently on Instagram.
Oh.
As we started chatting during the pandemic. And she is also a believer in natural things. She feeds her baby natural food. She believes in probiotics,
Yes.
all of that. She has a friend na nung pregnant, kawawa naman sige na, hayaan mo na. Ang primary source of nutrition, gummy bears.
Yun. And what happened?
Wala. I mean, tapos this friend of hers, nagalit pa sa kanya because she was talking about how nutrition plays a part in conceiving. But yun nga, na parang tayo, in the Philippines, pagbuntis, pagbigyan mo na,
Oo.
naglilihi. Pagbigyan mo na, naglilihi.
Yeah.
Laging ganon.
If a person is not allowed, is basically warned because they eat too much sweets because it's going to cause inflammation, whether PCOS in young women or
Gestational
diabetes or
in
diabetes in
pregnant
general.
women.
That's gonna go somewhere when you have a license and when you feel like you have a license to eat anything, and you tend to eat everything. So, ang mangyayari nun, may pupuntahan yung inflammation na yon.
That's true.
Diba?
But again, circling back to the warning about Tylenol,
Yeah.
acetaminophen, ibuprofen.
Oo.
You know, the main point there, the takeaway that I have from that video is yung nga, lowest possible dose and controlled use.
Yep.
Hindi yung kada konting take.
Pero yun
Take.
nga, you took it once in over a 37, 38 week window.
Yes.
So maybe that doesn't really affect it.
And also, it's important to note na sabi nga niya, if it's a high-grade fever, it could be harmful to the infant.
Yeah.
So, you weigh
But you
when
have to do-
take it. Diba?
No, yeah, you're talking about taking it. But what can you do to prevent it or avoid it from happening
That's
again?
true. Oo.
Kasi ang problema, when you take all that bad food, when you take all the stuff and you can't sleep and you know, it all factors in,
Yeah.
your immune system's gonna drop. You take
Then
it once.
you are more prone to get sick.
Yeah,
Like,
definitely.
recently, there was a virus going
Correct.
around in the school of our kids. They had to employ an academic break because more than half of the students are absent.
Yes.
And they're nagkakahawaan na, and our kids didn't get sick.
Yes.
So, nutrition plays a part on that part.
It's
na-
key to prevent.
Yes.
It's key for you to avoid situations like that or create a barrier to really protect yourself. I'm not saying that it's going to guarantee na wala kang sakit, but definitely it creates another level of protection. When that level of protection is there, you're not, just because somebody coughs at you or you go into a mall, when you get
Or-
home, you're not going to get...
Or
you're-
maulanan ka ng konti.
Yeah,
The next
definitely.
day, may sakit ka na.
Definitely.
Usong-uso dito sa atin yun eh. Ay, naulanan kasi ako eh.
Definitely.
You think it's the rain that actually got you sick? No, it's not.
Yeah.
It's how weak your immune system is.
Sobrang
Leading
weak
up
siya.
to that,
Nabasa ka lang ng ulan,
nagkasakit
sakit
ka
ka
na.
na.
Oo,
Oo.
ganun siya.
so hindi dahil sa ulan kaya ka nagkasakit.
Yes.
Bottom line, that's it.
But
right?
anyway, going back nga to the whole issue with Tylenol use and pregnancy. Bottom line, you use Tylenol for aches and pains, for fever, for things like that. In terms of fever, preventable if your immune system is strong.
Yes.
That's where nutrition comes in.
Let's give some tips in terms of supplements of what to take in
Okay.
on a day-to-day
For
basis.
immunity?
Besides
Okay.
the prenatal na binibigay ng mga doktor. Kasi a prenatal is standard. They give it to you, right? You can take D3, probiotics, vitamin C, and even a really good multi and omega-3.
That's true.
Yeah.
I actually
Heck of a
saw
lot
someone.
better than any of
wait,
those
wait.
things.
I saw someone comment on the Baron Method Instagram page asking, "Do we really need to supplement with D3?
Yeah.
If sunny naman daw sa Philippines, it's a tropical country." Hindi ko nga nasagot eh. It is a tropical country. It is sunny. But my gosh, most Pinoys
you go
naman
out?
takot na takot sa araw. We are
Takot
one of
umitim.
those cultures na lalabas lang, nakapayong.
Oo, takot umitim.
Which is, you
Di ba?
know, honestly quite unheard of in other countries na nagpapayong not because of the rain but because ayaw maarawan.
Right,
So
right.
we avoid the sun like a plague because we believe that being maputi is
Key.
nicer.
Yeah. Tsaka
Which is another discussion for another time. But yeah,
Eizza, pagka pregnant ka, it's so warm. Your body core temperature is so warm.
That's
during
true.
that time. Do you
Mainit ang
actually
katawan.
go out and
Yeah.
get sunlight during that time?
yes. So that's why. Again, what are those vitamins and minerals and supplements?
A very good probiotic, high amounts of cultures and multiple types of cultures will be very good. Vitamin C, broken down throughout the day. A good multi with a B, zinc, and all of those. Omega-3 is a very good one. And vitamin D3.
Omega-3 actually might be quite helpful for the brain development
Exactly,
of your
blood-brain
infant.
barrier. Yes, definitely. So any of those things are good. Just as how sugar or any of these high fructose corn syrups or these types of sugars are bad for your baby, these things are good naman for your kids.
Absolutely.
Diba? And for you.
And
For you.
before we close this off, I just wanted to note, you know how most pregnant women are saying, "Ay, won't it be harmful for my kid? Ay, baka bawal yan. Ay, baka ganito, baka ganyan." So, but you're not afraid of consuming gummy bears that have high
Food
fructose
coloring.
corn syrup, artificial flavors, artificial colors.
Yeah, lahat yon.
Lahat yun.
Oo.
So, where do you draw the line? Pick a lane, di ba?
I think right now, as a mother, you are not only responsible for your health, but for the health of your baby or your
Unborn child.
unborn child or
Correct.
any of your kids
So
that are born.
that's actually a good note to end with.
Oo.
When you consume something as a pregnant woman, remember, you are not just satisfying your craving.
Yeah.
You are not just putting food into your body. You're actually determining the future health of your unborn child.
I wanna say this before we close. Right now, we are at a world where information is readily available. But if you access the information right now, you are going to get more confused, more than ever.
Conflicting
Exactly.
opinions, conflicting studies. There's just so
Dr.
much
A says this, Dr. B says that. It's contra to each other.
Nutritionist A says this dahil paid siya by the fast food brand.
Right.
Nutritionist B says this because they totally believe in it. So
Yep.
it's just so many conflicting opinions, conflicting views.
You are responsible for your own body
Body.
and your own baby. Right now, nobody knows. The doctors don't know what to do. That's the truth of it all. Right now, gulong-gulo na sila.
Yeah.
So what do? You just go with what works and work even before. Eat well. Be healthy that way.
And that's how you protect your body and
Exactly.
your unborn child. That was the What the Actual Health podcast. Just a quick episode
Yes.
to address the recent issues that we see on social media and around the world. Hope you enjoyed that episode.
Take care. Thank you.